Nursing Tips 1. A nurse is performing routine assessment of an IV site in a patient receiving both IV fluids and medications through the line. Which of the following would indicate the need for discontinuation of the IV line as the next nursing action? A. The patient complains of pain on movement. B. The area proximal to the insertion site is reddened, warm, and painful. C. The IV solution is infusing too slowly, particularly when the limb is elevated. D. A hematoma is visible in the area of the IV insertion site. 1. Answer: B and 4. Site that is red, warm, painful and swollen indicates that phlebitis has developed in the line, should be discontinued and restarted at another site. Pain on movement should be managed by maneuvers such as splinting the limb with an IV board or gently shifting the position of the catheter before making a decision to remove the line. An IV line that is running slowly may simply need flushing or repositioning. A hematoma at the site is likely a result of minor bleeding at the time of insertion and does not require discontinuation of the line. 2. A hospitalized patient has received transfusions of 2 units of blood over the past few hours. A nurse enters the room to find the patient sitting up in bed, dyspneic and uncomfortable. On assessment, crackles are heard in the bases of both lungs, probably indicating that the patient is experiencing a complication of transfusion. Which of the following complications is most likely the cause of the patient's symptoms? A. Febrile non-hemolytic reaction. B. Allergic transfusion reaction. C. Acute hemolytic reaction. D. Fluid overload. 2. Answer: D. Fluid overload occurs when the fluid volume infused over a short period is too great for the vascular system, causing fluid leak into the lungs. Symptoms include dyspnea, rapid respirations, and discomfort as in the patient described. Febrile non-hemolytic reaction results in fever. Symptoms of allergic transfusion reaction would include flushing, itching, and a generalized rash. Acute hemolytic reaction may occur when a patient receives blood that is incompatible with his blood type. It is the most serious adverse transfusion reaction and can cause shock and death. 3. A patient in labor and delivery has just received an amniotomy. Which of the following is correct? Note: more than one answer may be correct. A. Frequent checks for cervical dilation will be needed after the procedure. B. Contractions may rapidly become stronger and closer together after the procedure. C. The FHR fetal heart rate will be followed closely after the procedure due to the possibility of cord compression. D. The procedure is usually painless and is followed by a gush of amniotic fluid. 3. Answer: B, C, and D. Uterine contractions typically become stronger and occur more closely together following amniotomy. The FHR is assessed immediately after the procedure and followed closely to detect changes that may indicate cord compression. The procedure itself is painless and results in the quick expulsion of amniotic fluid. Following amniotomy, cervical checks are minimized because of the risk of infection. Thanks for watching. Please subscribe. More nursing tips.